Complement plays a central role in innate immunity and has interactions with the inflammatory and coagulation pathways. Paroxysmal nocturnal hemoglobinuria, or PNH, is the prototypical complement-mediated disease, also known as a complementopathy. Other disorders falling into this category of interest to hematologists include atypical hemolytic uremic syndrome, cold agglutinin disease, antiphospholipid syndrome, the HELP syndrome, and hematopoietic transplant-associated thrombotic microangiopathy. Eculizumab, an inhibitor of complement C5 in the terminal complement pathway, was the first approved complement inhibitor in 2007 for the treatment of PNH. Subsequently, we've seen an expansion in complement therapeutics with novel mechanisms of action. In 2021, the first proximal complement inhibitor, pegcetacoplan, was approved for PNH. There may very well soon be multiple choices for the management of patients with PNH, as well as targeted anti-complement agents for other complementopathies. Let's review the complement inhibitors approved or in advanced clinical development, starting with terminal complement inhibitors that block at complement C5. Eculizumab is a humanized monoclonal antibody that binds C5 and prevents its cleavage, thus blocking the formation of the membrane attack complex and intravascular hemolysis in PNH. Ravulizumab targets the same C5 epitope as eculizumab, but differs structurally by 4 amino acids. This leads to an extended half-life. Eculizumab and ravulizumab are approved for the treatment of PNH and atypical hemolytic uremic syndrome. Eculizumab is also in a phase 1 trial for the treatment of HELP syndrome at less than 30 weeks gestational age. Additionally, there are cases describing the successful use of eculizumab in catastrophic antiphospholipid syndrome and antiphospholipid syndrome with refractory thrombosis, as well as for hyperhemolysis and sickle cell disease. Ravulizumab is in a phase 3 trial as treatment for transplant-associated TMA. Crovalimab is another long-acting monoclonal antibody against C5, but has a different binding site and mechanism of action than eculizumab and ravulizumab. It is a subcutaneous anti-C5 recycling antibody that enhances disposal of C5 in the endosome. Crovalimab is currently in phase 3 trials for PNH and atypical hemolytic uremic syndrome. Next, pozelimab in combination with cemdisiran is another monthly subcutaneous anti-C5 therapy in phase 3 trials for PNH. Pozelimab is a monoclonal antibody against C5, and cemdisiran is a small interfering RNA that suppresses hepatic production of C5. Lastly, the recombinant small protein inhibitor nomacopan, also known as poversin, is currently in phase 3 trial for transplant-associated TMA. In addition to C5, nomacopan also binds leukotriene B4, potentially modulating inflammatory pathways. Therapies have also been developed that target the proximal complement pathways. In PNH, these therapies have the potential to inhibit both intravascular and extravascular hemolysis, which is mediated by C3 fragments opsonizing PNH red cells. Pegcetacoplan is a pegylated peptide that binds C3 and C3b and primarily prevents interaction between C3 and the alternative pathway C3 convertase. It is administered as a subcutaneous infusion and was FDA approved for the treatment of PNH, both in the treatment-naive setting and for patients who have persistent symptomatic anemia on a C5 inhibitor. Additionally, pegcetacoplan is in trials for cold agglutinin disease and transplant-associated TMA. Iptacopan is an oral factor B inhibitor, a component of the alternative pathway of complement. A phase 3 trial of iptacopan was completed in patients with PNH who have persistent symptomatic anemia despite treatment with a C5 inhibitor. Iptacopan is also in trials for atypical hemolytic uremic syndrome and autoimmune cytopenias. Danicopan is an oral factor D inhibitor, also a component of the alternative pathway. Danicopan is in phase 3 trials as an add-on to anti-C5 therapy in patients with PNH who have clinical evidence of extravascular hemolysis on eculizumab or ravulizumab. Vimiracopan is another oral factor D inhibitor in a phase 2 trial as monotherapy for PNH. Sutimlimab is a monoclonal antibody that binds C1s and inhibits activation of the classical pathway of complement. Sutimlimab is approved for treating cold agglutinin disease. Additionally, a phase 1 trial was completed in chronic immune thrombocytopenia. Lastly, narsoplimab is a MASP-2 inhibitor which blocks the lectin pathway. A phase 2 trial was completed in transplant-associated TMA and is under review by the FDA.